Sorry about that, my headphones cut out. But so other SIP interactions, it interacts with tobacco smoking. That may increase. This isn't the same SIP that we were talking about, but 1A2. Um, and these are psych medications, so smoking may increase their effect. Watercress, which is a leafy green, starfruit, and golden seal. Golden seal is also a supplement that we'll talk much more about. So the effect of nutritional status on SIPs has been evaluated. And recall marasmus. This is uh, extreme malnutrition. They looked at marasmus and they found that it didn't have any effects on SIP metabolism, but when they looked at just kwashiorkor, which is protein energy malnutrition, it did have an effect on SIPs. Research has also evaluated the role of obesity and body weight on SIP availability. And obesity may decrease the activity of certain SIP enzymes, and it may increase the activity of others, although this is not well established. And a high protein diet can increase CYP1A2, whereas a high carbohydrate diet may decrease this. So knowing what medication the person is on, if it interferes with this enzyme or if it's metabolized by this enzyme, might make you consider different diets, or say your patient is on a keto diet, they're now taking a medication that may affect the CYP1A2, they may need to change their diet. So this is just a summary table of macronutrients and obesity on fasting and fasting on common SIPs. There isn't a lot of research on this, and so the effect is still unclear. So now we're just going to go through some common drugs and some of the food nutrient interactions that they can present. So lithium, one of our oldest mood stabilizers, its concentrations can be increased with diuretic use, antihypertension medicines, NSAIDs, so NSAIDs being our non-steroidal anti-inflammatory drugs, so Advil, aspirin. But we can get increased clearance of lithium with caffeine and sodium. So people taking lithium may need to limit caffeine and sodium, or else they may not get the full effect of their lithium. Dairy foods, which are high in multivalent cations, think calcium, can form insoluble chelates with fluoroquinolones, tetracyclines, and bisphosphonates, and this will reduce the absorption of these drugs, and thus reducing the therapeutic efficacy. So, dairy products should not be taken with these drugs or calcium supplements. They should be taken 2 hours before or 6 hours after administration. Fosamax, used for the treatment of osteoporosis. Large amounts of calcium, magnesium, and aluminum, which is found in antacids, will decrease the absorption. So this can be tough. Someone has osteoporosis, they might be taking a lot of calcium, but now they have decreased the absorption of their Fosamax. So at least half an hour should pass after intake of aldonderate before eating dairy products. And there can be a risk of ulceration, especially in the esophagus. Antibiotics also can interact with milk products. So it's these divalent cations like calcium, magnesium. They complex with some antibiotics and can prevent absorption. So erythromycin is decreased when taken with food, like I mentioned, 43%. Levothyroxine, used to treat thyroid hormone deficiency, can cause weight loss, high heart rate, sweating, anxiety. And we see decreased absorption with high soy, walnut, fiber intake, and again, these divalent cations. A study also found that levothyroxine absorption was decreased with cow's milk, probably due to the calcium content. And levothyroxine is absorbed in the jejunum and upper ileum. Absorption is increased by fasting and decreased with age. Cholestyramine sequesters bile salts. So this is a cholesterol medication. Because it sequesters the bile salts, it requires the body to use the cholesterol to create more bile salts. So it's acting a little bit like soluble fiber. But it may interfere with fat-soluble vitamin absorption. Dexamethasone is a synthetic corticosteroid. You'll see it used a lot in the ICU. It's anti-inflammatory and an immunosuppressant, but it has some pretty nasty long-term side effects. Thrush, this is basically a yeast infection of the throat. It can lead to bone loss, muscle weakness, weight gain, and type 2 diabetes. Again, because it's a corticosteroid. But a sudden withdrawal can lead to death. So you want to make sure that even if someone is experiencing side effects and they want to come off of corticosteroids, they have to do it slowly and under the supervision of a pharmacist and a doctor. Monoamine oxidase inhibitors, or MAOIs, are antidepressants and also used in Parkinson's. They have severe interactions with St. John's wort, with tryptophan. Remember, this is just an amino acid. With SAMe supplements, and with tyramine. Tyramine looks a lot like tyrosine. That's because they are similar. But tyramine is high in fermented, cured, pickled, aged, or spoiled foods. Fermented, cured, pickled, aged, basically all the tasty ones. So tyramine levels go up when foods are at room temperature or go past their freshness date. And MAOIs degrade monoamines like dopamine, norepinephrine, and serotonin. I mean, not the inhibitors, the monoamine oxidases are breaking down these monoamines, which is why monoamines like tyramine and tryptophan interact. So anti-cancer, anti-tumor drugs, mercaptopurin can be inactivated by xanthine oxidase. Intake of substances containing xanthine oxidase can potentially reduce bioavailability. And again, this is found in cow's milk. So patients should try to separate the taking of their mercaptopurin and drinking milk. Tamoxifen, sesame seeds, probably due to sesamein, negatively interfere with tamoxifen. Methotrexate is a chemotherapy. It's also used for autoimmune disease, ectopic pregnancies, and medical abortions. Intake of retinoids can increase the risk of hepatotoxicity. So this can be a problem if someone is on something like Accutane. And now we're flipping it. We're going to look at some foods and the drugs they can influence. So potassium-rich foods, think watermelons, bananas. Uh, they can interact with digoxin. They can also interact with renin inhibitors and potassium-sparing diuretics. So when taking any of these drugs, avoid potassium-rich foods and avoid herbal supplements such as dandelion, glossopol, and licorice. Honestly, pretty much just avoid herbal supplements. Like I mentioned before, vitamin K interacts with warfarin. Warfarin is a blood thinner. So, vitamin K is vital for the formation of the clotting factors 2, 7, 9, and 10, and anticoagulant proteins C and S. Um, Given that these are clotting factors, if you have a lot of vitamin K, then it's going to make it harder for warfarin to thin the blood. So, what we don't want to do is increase or decrease the intake of vitamin K rich foods while taking warfarin. So basically, like we see these green shake supplements now. If someone had been taking those green shake supplements for a really long time, starts on warfarin, you wouldn't want to suddenly decrease their intake of vitamin K. Similarly, if someone goes on warfarin, you would not want them to start taking those like green supplements. But also avoiding drastic changes in consumption of foods high in vitamin K. Not a lot of people eating beef liver, but that's one of them. Cabbage, Brussels sprouts, broccoli, kale, soybeans, are collard greens, and green tea. Uh, so warfarin can also be interfered with by fenugreek, or standby grapefruit juice, fish oil, fiber supplements, and mango. And these will actually potentiate, so this will thin the blood too much. Warfarin can be inhibited, though, by vitamin K and C, ginseng, the absolute worst, St. John's wort, soy milk, and seaweed. So we are generally encouraging people to take in as much more omega-3 fatty acid fish, but we do want to be concerned if someone is on an anticoagulant, antiplatelet therapy, including an aspirin therapy, as omega-3 fatty acids may increase the risk of increase the risk of bleeding because they increase the anticoagulant effects. So the protein-rich food interaction, like I mentioned before, beta blockers, but also our levodopa, theophylline, and carbidopa. So protein-rich foods will increase beta blockers, and they will decrease the efficacy of dopamine-based. Fiber-rich foods can delay the absorption of amoxicillin, digoxin, levothyroxine, and certain tricyclics. So you wouldn't want to take a fiber supplement or eat a bowl of oatmeal while taking your digoxin at the same time. Alcohol, pretty much just shouldn't have it, but especially with antidepressants and drugs that affect the brain and nervous system. If you drink 3 or more alcoholic drinks per day, the patient should consult with their doctor if they can even use NSAIDs or pain relievers, especially Tylenol, because it increases the chance of liver failure. Caffeine we usually don't think about caffeine as a drug, but certain drugs can interact with caffeine. So oral contraceptives, prednisone, um, will increase the effect of caffeine. So you could feel an arrhythmia. Theophylline, uh, this is going to increase theophylline. And then bronchodilators can also. For analgesics and antipyretics, so this is like Tylenol again. This should be taken on an empty stomach. That's going to have the maximum efficacy. Food can slow the absorption, but NSAIDs like ibuprofen, naproxen, I think that's Motrin or Aleve, uh, can cause stomach irritation, and this can be quite profound and result in cannot write this ulceration. So they should be taken with food or milk. On the other hand, caffeine increases the absorption of ibuprofen, and so the daily dosage and frequency of ibuprofen must be reduced when administered with Coca-Cola or coffee. Also, if you're hungover, the caffeine will increase the efficacy of the ibuprofen. It will work faster. So that's why people generally with a hangover will take an NSAID, not Tylenol, and will take it with a cup of coffee. Bronchodilators, high-fat meals may increase the amount of theophylline in the body, whereas high-carbohydrate meals may decrease it. So if someone is taking theophylline, so again for COPD or something like that, they should avoid eating or drinking large amounts of high fat, so like a fatty milkshake, but also those with caffeine. Licorice and chocolate can also interact with certain medications. Licorice can increase the risk of digoxin toxicity. It can also reduce the effects of blood pressure drugs or diuretics. And excessive amount of chocolate should not be consumed with MAOIs, Ritalin, or Ambien. And excessive is like a lot of chocolate. For someone on antihypertensive drugs, generally they should be on a moderate sodium restricted diet. A change in diet from a high carbohydrate to a low carbohydrate may increase oral clearance. And licorice, again, or the dietary supplement licorice can interact. In fact, it is a potent inhibitor, and it will increase excess cortisol. That will become a mineral corticoid, or it will hit the mineral corticoid receptors, causing sodium retention and potassium depletion, which is the opposite of what we want. And it may interfere with various medicines, including anti-arrhythmic agents and antihypertensives. So, more so, this would be if someone was taking the licorice extract or supplement. So, licorice is a bit odd. The main components of licorice root can have a mineral corticoid like effect, an anti androgen effect, or an estrogen like effect. Especially, and I'm not even going to try to pronounce this, but this component in licorice will prevent this enzyme, which means you will have more active cortisol. Active cortisol can act on the mineral corticoid receptors, so like aldosterone. So high intake of licorice can cause hypermineral corticodism, with sodium retention, potassium loss, edema, increased blood pressure, depression of the renin-angiotensin and aldosterone system. Antihistamines are, it's best to take on an empty stomach. Anti-tubercular drugs, so for tuberculosis. So isoniazid has been associated with tyramine and histamine interactions, and can also inhibit MAOs and histaminases. Food greatly decreases the bioavailability. So high fat meals will decrease serum concentration, and this may result in incomplete eradication of bacteria. Drug-resistant tuberculosis is a burgeoning world health problem. So we really want to make sure that we're not decreasing the efficacy of our isoniazids. On the other hand, oleanolic acid has antimicrobial activity against the Mycobacterium tuberculosis. So when administered with the isoniazids, it has a synergistic effect. So this would be things like garlic, holy basil, and table olives. Anti-diabetic agents, so glimepiride, which is a sulfonylurea, should be administered with breakfast or with the first main meal of the day. Glipizide, the immediate release should be taken 30 minutes before meals, and the extended release should be taken with breakfast. And acarbose, which is an alpha glucosidase inhibitor, can be taken immediately at the start of each meal, not a half an hour before or after, because this drug's whole deal is delaying carbohydrate absorption by inhibiting the enzyme glucosidase. Some other nutrient drug interactions: folic acid will decrease blood levels of phentonin. Iron, again, it's one of those cations, so it will decrease absorption of ACE inhibitors, levodopa, and methyldopa. Magnesium, on the other hand, can decrease the absorption of digoxin. And vitamin E can increase the effects of aspirin, digoxin, warfarin, and may interact with some immunosuppressant agents. So vitamin E may alter the effectiveness of, so this would be probably a blood thinner. It would probably increase that too much. Digoxin, we know, has a fat interaction, and then warfarin, it will also increase the effectiveness. And then zinc decreases the absorption of fluoroquinolones and tetracyclines. So these are antibiotics. And so often people take a high amount of zinc when they're feeling sick, but you do not want to do that if you've been prescribed an antibiotic.